Okay, thank you very much. Right now, as we are recording this episode on all health, we are in an active outbreak of Ebola in Uganda and DRC. There are very many things that have been done. We have response, management centers that have been actually established by the government, and also we have teams that are on ground to respond, and manage those few cases that we have. There are very many cases in our neighboring country, that is DRC, with also a certain number of confirmed cases in Uganda and a certain number of deaths. So today, mainly we are going to talk about Ebola, what it is, how it spreads from one person to the other, how dangerous it is, and how best can we keep ourselves in an environment that, protects us and keeps us, protected from Ebola spread, and also how we can identify those few people that you may come across. You say, this one maybe could be, needs to be isolated and, tested to see or confirm whether they are having Ebola. On our episode today on all health, we are having Dr. Alex Wesabula. He's a very, very good doctor and a colleague we've worked with for a very long time. Dr. Alex,
yes,
you're most welcome.
Thank you so much for inviting me to be part of this initiative, All Health. I want to thank you and your team for the good work that you're doing. Me, I personally believe that the reason as why we have poor health outcomes in our nation is one, people are not informed.
Yeah, true.
They don't know what
there
exactly
is
happening.
Huge information gap.
There's a big information gap in regards to health. And people not knowing, that means that even if they get these illnesses, it is very hard for them to go to health facilities when it is still early, so that we manage these situations when they are still manageable. Most of the times we find that our patients actually go to hospitals when the disease is out of control. So I want to thank you and your team, the producer, you, the moderator, and the whole team that you're working with. This is a very nice initiative, and for inviting me to talk about an outbreak of Ebola, something that is actually killing our people in our neighboring country, and also even our Uganda as a country we've lost some. So thank you so much for inviting me. It's my pleasure to be here.
You're most welcome, Doctor. So actually, mainly all health we are actually, as you've said, we are trying to balance it, information flow. People are out there. We are living a digital world. We believe that most of the people are having now smartphones. They can access this information.
Smartphone, Wi-Fi is people are working from home with WorkNet.
Exactly. So we are trying to bridge that gap of, bring information close to people. Yeah. So, Doctor, moving straight to the topic, in plain terms, if at all someone hears Ebola, what should they say? What is Ebola?
Ebola, in layman language, if I may put it in a way that everyone at least can understand, I can say is a hemorrhagic disease. Hemorrhagic meaning that it causes bleeding in nearly all the parts of the body. This is a disease that is caused by a virus called the Ebola virus. Those disease-causing organisms are really good. We have bacteria, we have virus, we have fungi, and quite a number of them. So if we talk about Ebola, it's a hemorrhagic disease that is caused by a group of virus called Ebola virus. These viruses, I think, are 6 in number that fall under this class of Ebola, of the Ebola virus that cause Ebola disease. And currently in Uganda and the Democratic Republic of Congo, we are undergoing an outbreak of Untold virus.
Okay.
So there are quite a number of these orthoviruses or virus strains that follow under this class of viruses called Ebola viruses that cause Ebola as a disease.
Yeah.
We know the Zaire strain, which is the most fatal, actually the most deadliest. Those who remember, I think we are not yet born in 1994. It killed quite a number of people. We have, that's the Zaire strain. We have the Sudan strain. It's the one that has been affecting Uganda most of the times in those recent outbreaks. Then we have Untold. There's one in Cote d'Ivoire. Then there are those two that are known not to really affect humans, but they are known viruses, or they are known viruses under this class of Ebola. So these viruses, literally, they are named depending on where they originate from, or where they are coming from. So we expect that if we say Untold virus, that means it should be coming from Untold, or it was first known to be happening, or first diagnosed around the Untold area. So currently we are having Untold virus. So that's here in the Republic of Congo and in Uganda. Yeah, basically that's what Ebola literally is.
Okay, doctor, thank you very much. So if at all someone is infected with Ebola, how do we get to know that this person is actually infected by the Ebola virus?
If someone is infected with Ebola virus, first of all, usually this virus, it has an incubation period.
Yeah.
If I talk about an incubation period of the virus, this is a time from when someone literally gets the virus, or from when someone gets the infecting organism, up to the time when they first see the signs and symptoms of the disease.
Yeah.
So, because whenever you go to any health worker, when you're having maybe a complaint, first of all, they'll get some history from you.
Yeah.
And you get history from this person, and you're like, your index of suspicion is like, the way this person is presenting, the way the symptoms that they're telling me, it's suspicious that they do have Ebola. So it's from both signs and symptoms, and then when you examine the patient, there are some things that you expected to see. And then also we do some laboratory investigations, which will help us to know that probably someone has Ebola, or they are at high index suspicion of having Ebola. And like I've expounded in previously, this disease, or the Ebola disease, because you have a virus, it affects you, damages your system, and then you end up with the disease. So Ebola as a disease is one multi-organ, meaning that it affects quite a number of systems and organs in the body. And most of the times, if it is not identified quite early, you can end up with multi-organ this damage. All systems and all organs in the body end up being affected. So in one of the things that will help us to really begin and feel like, this person is having Ebola, like I told you, are the signs that they come with. What are those things that they come with? How do they present? One, like I said, it's a
maybe, doctor, before we actually proceed to those signs and symptoms in detail, so this person has gotten to present with those few symptoms. Actually, how will he have gotten to such a level? How does someone get the Ebola virus?
How does someone get the Ebola virus?
Like, how can someone, get infected
with Ebola?
What are those routes?
So Ebola is basically a contagious disease. If I say contagious disease, it means that it's a disease that is spread or transmitted from one person to another. It's not a disease that maybe someone maybe gets out, maybe if their system has failed, like hypertension, that maybe I cannot transmit. This disease is transmissible. And maybe, as we shall discuss later, that one of the preventive modalities is to say that we reduce the spread from one person to another. So Ebola as a disease, like I expounded earlier, is something that is contagious, that it is spread from one person to another. But these organs, this virus that causes this disease is basically contacted by the first human, the first contact person who gets it. So the question that I want us to first ask ourselves, how do how does this first person that transmits it to the other gets it.
Okay. Yes, doctor.
This virus, literally, these different strains of Ebola are actually in animals.
Okay.
They are basically in animals. And if we try to follow how they are spread from the person to a human, it's basically through people that eat those animals or touch those animals when those animals are dead or when they die.
Okay.
Basically, we have monkeys and bats. The so-called those that touch on the roofs and fly and whatever. It's basically those two organisms that have those viruses in them. So if this person comes and scavenges or eats this animal that is infected by this virus,
by the Ebola virus,
yes, this will be the first contact person with that Ebola virus.
Yeah.
And then after the incubation period that we talked about, this person can literally spread the disease from one person to another. Okay. So these strains, at times they can be in animals when they are stable, because maybe they don't affect animals to the rate at which they affect human beings. So when they change the system from the system of a bat, which is different from a system of a human being, you expect, of course, this regulation in quite a number of systems and things, and then we end up having these symptoms and signs that we will talk about later.
Yeah,
but
now Uganda is an agro-based agriculture,
our economy is
agriculture,
It's the backbone, actually.
It is the backbone. Very many people are there into rearing. They are having cows, what? Does that virus also, be gotten from those animals that we rear?
Surprisingly, when this disease came, actually, quite research happens and to find out where exactly this Ebola virus came from and how it is spread. If it was spread from a monkey to a human being, can it now be spread maybe to a cow, or a goat, or a pig? These animals that are at home that we rear usually, and the birds that we rear or that we look after for purposes of generating income from them, research has shown that these organisms actually do not transmit Ebola. They rarely, they not even just rare, but they don't transmit Ebola virus.
Okay, thank you very much.
There has been a common myth and misconception that I've had while we are doing these campaigns to teach people about Ebola and how best we prevent it. And people are like, hey, there's this organism that you the Muslims usually don't want to hear about. That 100% its meat has to be, having Ebola virus. But research has shown that it's only bats and monkeys. Maybe if other animals come along the way, we also come back to all health and inform clarity. People that please now,
we've come to discover this.
But as of now, it's only bats and monkeys. So these other organisms, the cows, goats, and pigs have proven to really be very safe, and they are okay and free from Ebola virus, and so they cannot transmit. So meaning that even if you eat your pig, even if you eat pig meat, even if you eat beef, be rest assured that you cannot actually get the Ebola.
So this person has contracted the Ebola virus.
The first contact person has contracted
from the monkey or from the bat. How will that person again, how will the disease come to spread?
So how the disease comes to spread? First of all, like we have said, this disease is contagious, spreads from one person to another. So if I happen to get it into my system, like I've said, it will undergo an incubation period. Like I told the people that are watching us at All Health, that incubation period is a time from when I get the infection up to when I see signs and symptoms. So usually this disease in this time, it is affecting organs, different organs in the body. But one of the organs that are mostly affected are our blood vessels and the circulation system. The system that helps us to deliver oxygen and take away carbon dioxide, deliver nutrients to the different parts of the body. In affecting these blood vessels, the Ebola virus makes our blood vessels leaky or like weak, meaning that blood can easily escape from our vessels to anywhere it wants to go. Meaning that like we said that this is a hemorrhagic fever, or this is a hemorrhagic disease, you will see someone having features that are suggestive of bleeding, bleeding that is unexplained. Maybe someone is bleeding, as they're urinating, urine comes out with blood, if they're passing stool. So by the time we see symptoms coming, well, that means that the Ebola virus has kind of spread. And now it can actually be transmitted from one person to the other. And just like you asked, how does this transmission happen? So if we have this virus affecting our blood vessels, escape to the different body fluids and systems, of course these systems have body fluids. At the end of the day, the virus will pass through the body fluids. Meaning that every body fluid that I can think about has the capability or the capacity of transmitting or containing this virus that can be transmitted from one person to the other. Like we have said, the premier fluid of transmission is blood. So the moment we have contact between the blood of an infected person and the blood of an uninfected person, the chances of transmission are really high. And also then we talk about these other fluids, if maybe the virus escapes into sweat, urine, we have talked about stool, saliva, think about semen. So all the body fluids that someone can think about, they have really the potential of transmission of this virus from one person to the other. And there has been a growing myth and misconception about Ebola virus and its transmission, whereby now when we had just started hearing about Ebola in Republic of Congo and then to Uganda, people started putting on masks. People started putting on masks, and like I told you, all this happens because of lack of clear information about these diseases. So someone thinks that maybe if they protect themselves from air that others are breathing, probably they are protecting themselves against this Ebola virus. But I just want to use this platform to make it clear that Ebola virus is not airborne. It cannot be transmitted, just like flu and cough, maybe from this person to another, through just air that they breathe out. It's basically through body fluids. So all the body fluids that I think about really have the capacity and the potential of transmission of Ebola virus. And like we say, these organisms, we should avoid eating them because also that's where the first contact or the first person to get the virus gets it from, and then they start spreading it. When these organisms also die, we should avoid them, especially the monkeys and the rats. But as well, our very beloved people. There's a team that is put there to take care of this when they pass on.
Actually, there is a team being facilitated by government.
By the government, by the Ministry.
By the Ministry of Health. It is there. If at all you lose someone over Ebola, they are there to ensure that they give dignified and
safe burial techniques to the people that actually succumb to Ebola, but not just to come and bury them as us, or even sometimes the team comes, buries those people in a way that is put there to ensure that we don't transmit the Ebola from the dead person to us, the people that are living. But still, people go and extract them from the ground to rebury them.
Actually, it was happening in Congo. Some of the people were actually, attacking
that team of people that are supposed to.
People were actually stealing away their bodies, the bodies of their people.
And I think it's the same thing that happened in COVID, because still in COVID-19, still we had the same kind of situation.
True.
Quite a team was put there to ensure that these people are buried with dignity, but as well taking precautions to ensure that we don't transmit the Ebola virus. But then we had the case of, I think, a family in India, if you remember, the whole family that succumbed to COVID-19. Then we also had a family around Uganda here that also went and extracted their dead bodies so that they will be buried. So despite the fact that we have our cultural norms and beliefs, as people who belong to different cultures, for now all we want is to be alive. And despite the fact that the ministry has done really its strikes, The number of new cases have kind of gone down. Deaths have gone down.
Actually, we've gone some good days without registering the new case.
But still, Ebola is like that. Yeah. So we should really take the onus and the precautions as stated by the ministry. The precautions that the president gives us in his different presidential addresses to the country to ensure that we really don't transmit this Ebola virus from the infected to the uninfected people.
Yes. Thank you so much, Doctor. So, someone has gotten the Ebola virus. If at all the incubation period, is due and they are sick, how will they present?
How do they present?
What will you look at and say this person? You suspect Ebola.
You suspect that they have Ebola.
Yeah.
Just like I said, usually what really makes us to go to health facilities to seek medical care is if we get maybe some sort of discomfort in our day-to-day life.
Exactly.
So it's the same thing that actually Ebola does to us. And if you find us men, at times men tend to have poor health-seeking behaviors. Men usually go to health facilities when they can't walk.
When they can no longer walk.
When they can no longer walk.
That is when a man
can maybe tried other options and other options have failed. But in regards to Ebola, like we said, it's a hemorrhagic disease. It gives us what we call hemorrhagic fever. So usually, just like any other infection, just like any other bacterial infection, just like any other viral infection, we usually expect these infections to come with the fevers.
Exactly.
Because if this virus gets into the body is not sitting. You understand? The body also tries to kind of fight against the virus. So in the due process of fighting against the virus, it releases some substances which aid in fighting against the virus. But these substances still cause the body to get fever. So most of the times you see someone, they are nursing someone, or they are nursing their loved ones with a fever. But they have probably done all the investigations to find out what could be causing this fever, and they are not able to get to know what exactly is causing this fever. Maybe you run a malaria test, it's negative. You run typhoid, it's negative. Sometimes you rush and do urinalysis, it's negative. Be suspicious and be like, why is this fever literally? Why can't I find a cause to this fever? Chances are high that it could be actually Ebola that you're dealing with, Ebola disease. And then this fever also may not go with our normal anti-fever medications that we usually give. Nje omwana inayo akakaliro nti atumweyo kapanado. Nje atumweyo ka ibuprofen. You can give the paracetamol, you can give the ibuprofen, you can do the tepid sponging, and nothing literally changes. So usually these fevers are in such a way that they are very high. That's one. Two, they have no any identifiable cause. You run your investigations, run your typhoid, run your analysis, run your CBC.
You don't find the cause.
You're not able to pick out the cause. Three, these fevers really don't go with these normal medications that we give for fevers. That's why it's advisable that in such scenarios, if you're a doctor and this patient has come to you, because you usually see these patients, you at least have to screen them comprehensively. And if you're suspecting that maybe this patient could be in contact or could have contacted someone with Ebola virus and they have such symptoms or such fevers, you easily refer them. They are persistent and they are very brutal. And then we talked about the fact that this disease is hemorrhagic. Hemorrhage is a scientific word for like bleeding. So it causes bleeding in literally all parts of the body. So you can expect someone maybe to bleed in the ears. You expect someone to bleed in the gums or in the mouth, around the teeth. You expect someone to bleed through the nose. You expect someone to bleed through the ears. Like literally everywhere can bleed. Body under openings. The skin, body openings, but still under the skin. You see someone having a fever, then they are bleeding. You understand? Usually there are marks around. There could be marks of of bleeding that happened quite some time ago, and then there could be marks of fresh flesh, blood of fresh bleeding that happened recently. Your index of suspicion should still go to Ebola virus and Ebola disease and the disease it causes. We've talked about stool. Still, you can bleed in the stool. Someone passes out fecal matter, and this fecal matter has blood stains in it.
Bloody diarrhea.
Yes, bloody diarrhea. Sometimes it can be just diarrhea and it is really bloody. Sometimes you can have urine coming out and this urine is literally blood stain. But still, like we have said, it's a multi-organ disease. It literally affects all organs in the body. Some people may have difficulty in swallowing because it affected maybe their throat. Some can have the vomiting. Still, the vomiters will be containing blood. You know, some people can have difficulties in breathing, meaning that now the disease is affecting their lungs and the chest, and they cannot breathe well. So it's a consortium of symptoms. But usually, when these symptoms happen, it shows that the disease has literally gone through this window period, and now it is literally affecting someone. So it's by the time we see these symptoms, the disease has literally advanced.
Thank you so much, Doctor. So we've confirmed. Okay, we've not yet confirmed, but we've come to suspect this person here, this patient, Mwakimbon, is most likely to be infected with the Ebola virus. How do we come to confirm that this person is having actually Ebola virus? Is infected.
Maybe shortly, apologies. Something that I didn't expound more in the previous discussion that we had.
The symptoms.
Because someone is bleeding, you know, they are losing blood. Like we said, it's an allergic disease. And someone is also losing a lot of fluid. Maybe because they are vomiting, maybe because they are diureting, you know, maybe because they are excessively diaphoretic. You understand? Ebola virus and Ebola disease will make you lose appetite completely. So meaning that you're not taking in food, you're not taking in water. Chances are high that you're going to be dehydrated. You understand? Find someone, they are losing a lot of fluid, but their lips are dry. You know, their skin is really very dry and very scaly. You understand? They have a very high skin tagger. So you think that maybe this person is losing a lot of fluid because they are diuretic, and likely the diarrhea is because of the Ebola virus. And just like you said, they will be extremely weak. You
also body
pains and muscular pains, joint pains, and these are literally unexplainable. There's nothing that you can make them up to. So your index of suspicion tells you that maybe this is an Ebola case. And back to what you had asked prior. What exactly do we do to confirm? And after us being suspicious, after us having a very high index of suspicion that probably this person has Ebola, what exactly do we do? We do some sort of laboratory investigations. You understand? We do some sort of laboratory investigations. There's a test called PCR. This test looks at the genetic composition of our cells. For example, in case you have any form of disease, and you can do these, rapid diagnostic tests, but they don't look at the DNA of the cells. So we at times collect these fluids that these people are actually producing. At times we can go and do some swabs in the different parts of the body, and then you take these swabs for genetic testing, or to test for the genetic material of the Ebola virus called PCR, polyclonal chain reaction. And this test actually, as we are doing it, it also helps us to know which strain of Ebola are we living with. Just like I said that there are about 6 strains, and each of these strains has a different fatality level. Like it kills people at different rates, and also causes disease at different rates.
So the severity of the disease.
So this polymerase chain reaction will help us to find out, one, confirm if it is Ebola virus, but as well look at the strain of the Ebola that is causing this disease. Yes. So that's how we confirm that
this person could be having Ebola virus.
Yes.
Okay. So, doctor, we've confirmed that this patient is having the Ebola virus. How do we start the management? How do we manage this patient?
How do we manage
situation?
Patients? In managing our Ebola patients, just like I said, most of these viral diseases or diseases that are caused by viruses are actually self-limiting. What do I mean by self-limiting? Is that if I get a disease, the body gets a way of dealing with that disease, and the disease subsides. Just like someone gets a cough, they have not sought any kind of medical treatment, and the cough resolves on its own, because the body is also fighting against this cough. So that's why it's self-limiting diseases usually are.
So you're trying to imply that there is no specific cure.
There is no specific
treatment
for the Ebola virus. The Ebola virus that we have, the Ebola strain that we have, the Untold virus.
So how do we, if at all there is no specific treatment to cure this Ebola virus infection, how can we help this patient?
What we usually do is basically supportive management.
Supportive management.
What do I mean by supportive management? We are not going to give a definitive treatment against the individual virus strain because it is not there. There are some viral strains of Ebola that have a definitive treatment. That we give them antibodies, we give these patients antibodies to aid their body in fighting against the virus or the viral strain that we have. But for Untold virus, the one that we are having now, the one that is affecting Uganda now and the Democratic Republic of Congo, one, there is no definitive cure, and also there is no vaccine. So for it, what we basically do, what is being done currently in the different health centers and health facilities that the ministry has put to be taking care of those people, is basically to do supportive management. What do I mean by supportive management? What kills you is not the Ebola virus or the Ebola disease, but the symptoms that it causes. For example, if I'm bleeding in literally all parts of the body, I'm going to bleed till my body loses all that blood and probably I pass on because of anemia. If I'm losing a lot of fluid from the body, I'm going to get dehydrated. I continue losing until I pass on. Maybe if the fever has really go beyond what my body can accommodate, what my body can withstand, the patient can pass on because of hyperpyrexia, very, very high fever. So what we do is to manage these symptoms, that they don't kill these patients as maybe what other strains would do. And then we leave the body to fight against the virus. We give a grace time period for the body to fight against the virus.
So mainly what the medical team does is to support the body's immune system. Make the patient as much comfortable as you can. Reduce those fevers. If the patient needs blood, maybe give them blood because they are losing. Give them fluids. But as well as we do this, as well as health workers, as we are doing this, we also have to use PPEs, personal protective equipment, because this disease is contagious. Anyway, just maybe if we shall discuss about prevention. But basically, that's what we do, the supportive management. But for these other strains that have happened before, the strains that have treatment, we just give the treatment that kills the virus. But for now, for this exact strain, the individual virus strain, the individual Ebola virus strain, it has no definitive treatment. So we just do supportive management as the body deals with the Ebola virus itself. Okay, thank you very much, Doctor. You know, there have been campaigns on different media houses, MBS, where televisions and actually even on radios, they try to inform the community on how we can prevent, transmission of this Ebola virus. For purposes of emphasizing that actually prevention is better than cure. It is better safe than what? Than treating the actual.
It's better to prevent a disease than to treat a disease.
Because the most important thing, in public health, we we actually look at, you know, how best can we keep the community in a preventive mode than actually treating mode.
Yeah, sure. Before they get the disease, how best can they keep safe from
getting the disease? That is actually one of the most important things that the health sector should look at. You know, how best can we keep the community safe from not getting the diseases? You get, than coming in, you know, aggressively at that point of treating. You know, so I want us to look at this. I want to actually to talk about this. How best can we prevent the Ebola transmission, both at community level and personal level, and actually even health workers
and facilities.
Yeah.
Thank you so much. Just like you said, when we're talking about prevention of diseases, there are levels to prevention of the disease. The first one is the primary prevention of the disease.
Yeah.
And this one deals with ensuring that people don't get the disease at all. Then 2 is secondary prevention of the disease, which looks at the fact that our primary prevention has failed. Someone has gotten a disease. But how best can we know that this person has gotten a disease a bit early, so that we also link them to care when it is still early. Like when the disease has not kind of too much affected their body systems. And then we have the tertiary prevention of disease, because these diseases usually come with complications.
Exactly.
So tertiary prevention is about early treatment. After early treatment, we also do rehabilitation of those with complications to ensure that maybe the complications don't so much affect their quality of life. So Ebola still also follows under the same protocol. And still the ministry is also targeting all of those levels of prevention of the disease. I'll give an example, just like you said. At the community level, because we are much more sensitizing about our people in the communities, so that they are empowered with information. Something that we talked about is the safe burial practices. This person has died of Ebola. Despite the fact that they are our loved ones, can we agree that probably their dead body is also a very potential tool to transmit Ebola virus from them to us as the community? All people in the community sensitized, or do they know that actually this dead person can actually transmit the disease to the dead body? So one of them is the safe burial practices. People that have died of Ebola, to our people out there, we should deter from extracting those dead bodies from their graves, because they have been buried with the dignity, and usually the team is equipped with skills to ensure that they don't transmit in any way. Then 2, just like we've said that this disease is contagious from one person to another through body fluids. So one of the things that we should so much do is to try as much as we can to avoid contact with body fluids. Body fluids from one person to another, especially those that are really suspicious. Someone has the symptoms that we talked about, the signs that we talked about, we should ensure that at least we don't get into contact with them. Just their clothing, their body fluids that we talked about, the surfaces that they touch, because probably they can leave sweat there. We should literally avoid all these surfaces. And then for the surfaces that are maybe communal, for example, the toilet door handle, the handle of a door of maybe a room or a house or the classroom. These are surfaces that should be cleaned regularly, because like we said, someone comes and touches them, they leave their sweat, which is very potential of carrying the Ebola virus. And then if the next person comes and touches the same door, when it has not been sanitized or cleaned with alcohol-based sanitizers, chances are high that this person will transmit the virus to the next person. Then we also talked about safe sexual practices. I understand there are people that that are driven by sex. They live by sex. But
at least
without it,
on a daily.
But we advise that at least let them practice safe sexual practices. These are body fluids, some of the body fluids, especially semen, have the potential of having the virus for as long as 6 months.
That is a very long
That's
time.
a very long period of time.
Yeah.
And it is very hard to tell someone to abstain for a period of 6 months. Just like I said that there are people that live by it, that at least they have to engage at least once a day. So at least we advise that engage safely. If maybe your partner was tested positive for Ebola virus, they were treated and discharged. It is prudent that they use a condom. You understand? They use a condom for at least up to 6 months. Or when we test them and we confirm that even their semen is negative. Because these body fluids.
The best thing, doctor, could have been even abstaining totally. Because you know that process.
You know,
fluids
times have changed. Those days it was easy to preach abstinence because even people were not practicing sexual intercourse before marriage. But times have changed currently. Now at least we want to preach to people how to do it safely, other than telling them, why you abstain, because you're sure they cannot. Yeah, but then how do they do it safely? At least we advising that they use barrier methods. Using barrier methods, what do we mean? Condoms, because there is completely no transmission of fluids from one person to another. Yeah. And in that case, they are really mutually safe. Then at a hospital level, I want to thank the Ministry of Health of the Republic of Uganda. That if you look at these facilities, they have put a focal person. Yeah. An Ebola focal person who is at least spearheading all the operations against Ebola, case identification and suspicion. That if I look at someone having those signs and symptoms that we talked about, there is a team that literally knows how to, identify those people. Yeah. You understand? And then referral system, because not all health facilities have this service within. One, diagnosing Ebola. Not all health facilities do PCR. Yeah, true. Not all health facilities are equipped with health workers that can treat these patients of Ebola. So at the health facility level, there are focal people. There must be at least a focal person to ensure that this person spearheads one, identification, referral, and in some cases management of these patients. But as well, there are infection prevention and control focal persons at health facilities. These are people that we talked about personal protective equipment. Maybe I have someone who I'm suspecting that they have Ebola, but they need attention. They need medical attention. How am I going to approach them? Am I just going to go the way I am here? Do I need maybe to put on gloves, put on an apron, put on glasses, the goggles that usually use when you're going to see these patients, put on gambutus, you understand? To understand, to prevent the transmission, that in case this person is positive of Ebola, at least we don't have the transmission to this person that is negative, this health worker that is coming to take care of them. Just like we said, these health workers also should use PPEs, personal protective equipment. These our health workers literally at all health facilities. The ministry has done a good job to empower them with knowledge and information, case identification, and as well referral. Then in those facilities where they are managing management, at least if I see this patient and I'm suspicious that we have a dog, what do I do next? That's at a community level, personal level, and then at the level of the health facility where patients seek care from.
Thank you very much, Doctor. So we've actually talked about almost how we can contract it, treatment, what prevention. Let us bring it back home. What is the current status of Ebola in Uganda?
The current status of Ebola in Uganda. First of all, Uganda has had about 10 outbreaks. From the first time Ebola was first discovered in the Democratic Republic of Congo, that's about 1976. I think my parents are not even talking about me. That's the first time that actually we discovered Ebola in Africa. We have had about 10, 10 outbreaks of Ebola. But we have had only 6 outbreaks of Ebola that have happened whereby they are seeding from our country, Uganda. These other outbreaks of Ebola come in because of spillage of people from these neighboring countries.
Yeah, true.
Like we talked of this current episode, the current outbreak of the individual virus strain. It's a strain that started from Democratic Republic of Congo, on our borders, our immediate borders in eastern Uganda. DR Congo has about those two provinces that are close to Uganda. I think it's called Ituri province and Kivu province. Those are the provinces that are most affected by the virus, by the Ebola disease, and those are the provinces that are closest to Uganda. So it is easier for the disease to move from one person to another along the border, and then people keep spreading it. Actually, the most recent, I think, news of the transmission was in France, where someone moved from Democratic Republic of Congo up to France with the disease, and the disease had never happened in France. So we are in our 10th outbreak, and 6 outbreaks have actually started here, and then these other outbreaks usually happen because of transmission from these neighboring countries. And we have had up to 20 cases, but still of these 20 cases as Uganda in this current outbreak, the 15 came from Democratic Republic of Congo. That someone came from DR Congo, they don't know that probably they have the disease. They reach here, and
the incubation period
has passed, and by the time we test them, we find that, hey, these people do have Ebola. We also have had 5 cases, meaning that probably someone came with Ebola from wherever they came from maybe Ituri or Kivu province. They came to Uganda, then there was contact, and then after contact another person gets the disease. So we have had only 5 cases of the disease that have been found to have people to have gotten infected while they are in Uganda. But these other 15 have actually come as a result of spillage from these neighboring countries. So we have had up to 20 confirmed cases. Of these 20 confirmed cases, like I've said, 15 came from DR Congo, and then only 5 came from here. So of these 20 cases, it's very fortunate that 16 have completely recovered. So they have recovered and they have been discharged when they have been declared Ebola free, that they don't have. Then 20 minus 16, I think it's about 4. Unfortunately, 2 lives have been lost due to the complications of the Ebola virus, the Ebola disease, and its complications. And then we still have only 2 active cases. The ministry has also done great strides in contact tracing. Contact tracing, what do I mean? Is that if maybe I have Ebola disease, I came from DR Congo with signs and symptoms of Ebola, we have done PCR, and this person has tested positive for Ebola. The ministry usually does contact tracing, that you go on in the communities looking for people, the close contacts of these people. So of these 20 cases, we have had up to 831 contacts traced. Of the 20, you understand? Just like I have come here and maybe you have had a discussion, probably,
after here you go and meet someone.
Yeah, sure. And maybe I get the disease. So they will trace the people that maybe I got into contact with before I came here. So that's what the ministry is currently doing. So up to 831 contacts have been traced, and 821 have been discharged. Usually we do this contact tracing. These are contacts of the positive cases that are confirmed. Put in quarantine for a total of 21 days. Like we said that the incubation period is 21 days. Meaning that in 21 days, if I have the disease, if I contacted the disease from this person that was that tested positive for Ebola, I will get it after 3 weeks. So at the end of 3 weeks, if the tests show negative, that means that I did not contact the disease. But to our neighbors in DR Congo, the situation is still not so good. It is still a dire situation. About 1,400, I think, and around 61 people have confirmed positive with Ebola virus. And of these, 426, that's quite a large number of people have actually lost lives due to individual virus strain or Ebola disease that is due to Ebola virus. So yeah, that's the current state of Ebola virus. That's why I'm bringing in DR Congo, because this is a strain that did not start here.
Yeah.
It started from the Democratic Republic of Congo, but these are our people. You know, those people that breach. Gold is coming from Congo, timber is coming from, quite a number of things are coming from Congo.
Yeah.
So meaning that if we have a disease like Ebola affecting our people in Congo, they are our close neighbors, meaning that we do cross-border trade. So that puts Uganda at risk. Okay. Yes.
So, Doctor, I think according to the information you've given us, it is kind of reassuring that, the management within our country has been kind of good.
Yeah. I think the ministry has done its role. I want to thank the Permanent Secretary, Dr. Diana Twine. COVID was first announced when we had Dr. Luther Chenga as the Minister of Health. And then Dr. Balimus also came in, and they are really doing some good work. And the rest of the team at the ministry. The disease, I can say, is at least contained. We are not yet free of Ebola, but at least the disease is contained.
Yes, doctor.
In relation, or if you compare with our closest neighbors,
From our discussion with health, you've broken actually some myths. You know, some people are out there, they think that Ebola virus can be transmitted through the air like flu, which is not the case.
It's not the case.
And also,
Ebola is not airborne. It's not transmitted like maybe flu and cough, that maybe someone gets close to me, they have flu, and then also tomorrow I wake up sneezing. No, it's not a disease that is airborne. It's transmitted, like we said, via body fluids. It's contagious from one person to another, but via body fluids, not airborne.
And some people actually also think that Ebola virus, once you're confirmed to be having the Ebola viral infection, you're going to die.
Like it's a death sentence, it's a death penalty.
It's like a death sentence.
Except if you get the disease and you decide to lock yourself in your house and you don't move out and seek help.
Yeah, true.
But just like I've told you, out of the 20 you have only lost 2. That's about 10%, which is really, really a good number. Because some of these, if you look at the percentage of DR Congo, because of the big numbers, you understand?
Yeah, true.
There may be contact tracing, because of the big numbers is still not as that of Uganda. They have lost quite many. So Ebola virus and the disease it causes, it's not a death sentence. But with proper early identification, you understand? That maybe if I see signs, which are something like that, before the disease really advances and I seek care, chances are high, 90% that I will survive. And so it's not a death sentence, it's not a death penalty. People get Ebola, they are treated and managed, and they are discharged when they are negative and they are safe from Ebola.
Okay, thank you very much. Then there are these people who actually, they have their people sick at home and they decide to use herbal medication.
I don't know.
What do you have for those people?
You know, times have changed. There are things that our grandparents used to do, and they were safe and okay.
Yeah.
Some of them are actually herbal medications. Those days when we didn't have quite too much advancement in science, vaccines. People used to do herbals, and somehow, somewhere, those still deaths were many. Because, for example, if you look at all the parameters, maybe maternal mortality, the deaths were many. In terms of people that are dying per maybe 1,000 people, they were quite many. But now science has advanced, and I'm thinking, or I'm sure, that with advancement in science helps us to okuzula. I don't know how you put it. Okuzula ebintu ebipya, finding better things, getting better solutions to different problems. You understand? So some of the things that usually come out of science or come as a result of science is vaccines. All these treatments that I talked about, the treatment modalities that I talked about, for example, the antibodies that are given maybe for the other strains of Ebola that I talked about. So, if I give you a chaka or the local herbs, just the high that I make the condition even worse.
Exactly.
Because the challenge we have with these local herbs, at times they could be having active components that we even use to make these medications or medicines. But challenge comes in with the quantity. If maybe I go and I have maybe flu, and I'm told that lemon treats flu, how many lemons should I take in a day?
Exactly.
You understand? So if it is about a chaka, how much should I take, to have my condition treated? We've had patients come with maybe diabetes. Someone starts their chaka. About 6 months down the road, the liver is hit down, the kidneys hit down. So I don't demoralize or demotivate people from using local herbs, but at least they should be really regulated. For Ebola case, they are not really recommended Ebola virus and the disease it causes.
Okay, thank you very much, Doctor, for those very good insights. As before we wrap up this episode, what information do you leave to the person who has been watching this series, and which information do you leave to those people?
To us people that have not been here for long, sometimes we believe that Ebola is like a myth. It's like something that is very abstract. It's maybe something that happened years ago. It's something historical. Maybe that we are safe. There's something that I always ask my patients. Whenever I'm in a clinical room and maybe I'm talking about something with the patient is like, yeah, me? You understand? Maybe we are talking about HIV. And someone is like, yeah, me, I can't get HIV. And I usually ask them, so do you think those that get HIV, are they like labeled the mark that, if they have this mark, they can easily get HIV? So it's the same thing with Ebola. Just like I've said, that it's not history, and it's not something very abstract. It is something that is here with us. So the earlier we come to terms with the fact that Ebola is here with us, and the earlier we come to terms that it is upon us to take charge of our lives, know how best we can prevent ourselves from contracting the disease, and know where to seek treatment from. Because just like I've said, there's no marker that maybe this person will contract Ebola. Maybe this person will die of Ebola. So meaning that we should keep ourselves safe and then seek medical attention whenever there are features suggesting that maybe we could be having Ebola.
Thank you very much, Doctor. Those were very that you've actually raised, and for anyone who has been listening in and you have concerns or you want to report a suspected case, Ministry of Health in Uganda has put up direct channels.
Actually, they are free of cost even.
You call toll free. You can call on 0800-100-066.
The challenge that we usually we had of recent. Someone maybe spends 2 days without eating, they get hungry, they get low blood sugar levels and they fall down. Someone just gets and just like we said, if maybe someone is bleeding or they have fevers, we shouldn't really over recall. But it's good that those cases that are really very suspicious,
yeah,
we inform the ministry so that they send people to evacuate those people from the community.
Exactly.
But people who fall down because they have refused to eat for 2 days, I don't think it should be people in the ministry.
Yeah, so if I told you are close to a person who has those symptoms and signs that we've talked about, you can call on that number, or you can send an alert SMS on Airtel 6767, or reach out through you report at 8500. Doctor, thank you so much for the clear and genuine information you shared with us.
Thank you so much, Dr. Sulaiman, and all help for hosting me. I hope this is not the last time.
Exactly.
It has been the first time to set a precedent. To our viewers out there, please like this channel, follow, comment where necessary, ask questions so that we keep engaging.
Exactly.
At times there are things that we may not be able to delve deep because we have limited time. But in case you have any concerns, any queries, you can, visit the podcast, the YouTube channel. Ask those questions so that we
shall actually respond.
So I hope this has set a precedent.
Yeah, true.
That I will come back here.
We shall have you more and more times here so that we share information to people.
To be a pleasure.
Information is power.
Yeah, sure.
Yeah, thank you very much for all those who have been tuned in and to all those who have watched this podcast. It has been all health. We are always here to discuss or bring to you important information about your health, about the current, health status quo within your environment or communities that you're living in. Until we meet again, please keep safe. Your life and health are very important. A sick person doesn't work, doesn't make money. Keep healthy, go to the streets and look for the money. Like, comment, subscribe, follow on TikTok and even on our YouTube channels. Thank you very much. It has been all health about Ebola. Your host has been Dr. Sulaiman Namonza with our doctor who has been a panelist, Dr. Alex Wesabula.
Thank you so much.